The government shutdown was just a couple of days ago, but yesterday, October 2nd, I got this letter talking about how my monthly premiums are going to go up for my health insurance. They obviously sent this out before the shutdown even took place in order for me to get it yesterday. So look at this. 2025 monthly payment is $218. They broke it down for me though. Thank you. Here's the math, bitch. Monthly premium of $627 minus $409 of financial help you get each month. That's the Affordable Care Act going away. So $627 is right now. Starting in January, it's going to be $727. So not only did they take away the $409, they increased this motherfucker by $100 a month.
The shutdown fight has exposed how broken our healthcare system is. Can you believe that premiums are going to go up 100% for 24 million American families if we don't extend the tax credits for the Affordable Care Act? That means tens of thousands of people will go without care, and thousands of people will simply die without care. The reality is we need Medicare for all in this country. Every person from the day they are born should have health care. This is the time to reintroduce the idea of Medicare for all and start to demand that we vote on it in the Capitol.
People deserve free or at least affordable health care, and that shouldn't be a divisive take, but in the United States it is. And Democrats are fighting for millions of Americans to retain at least some semblance of affordable health care, even as Republicans wish to strip it away from Americans. And that's at the crux what this government shutdown is about. Democrats wish to keep people with benefits that otherwise would make certain that they do not have access to affordable health care. And when we say they won't have access to affordable health care, who among us can take an almost $27,000 a year hit? Because that's exactly what's going to happen to the average American utilizing Affordable Care Act subsidies.
They are absolutely correct, you guys. And right here is a little side-by-side comparison because, you know, MAGA, they love to look at charts and they need something, some sort of picture so that they can really understand things. So this is with the Affordable Cares Act. This is without the Affordable Cares Act. And this is what the Democratic Party was trying to stop before this whole government shutdown, because the Republican Party wants to remove the Affordable Cares Act. That's what they want to do. It's not about undocumented migrants getting health care. It is not about that. It is about the lower class and middle class citizens here in the United States of America that can afford health insurance, plain and simple.
So Republicans shut down the government because they want to take health care away from millions of people. Even if you believe the lies that this is all about undocumented immigrants, how can you think you're a good person wanting to take away health care from millions of people? How do you call yourself a Christian? Do you really think this is what Jesus would do? Taking away health care from fellow Christians? And if you remember the last time the Republicans tried to shut down the government, what was it over? Food stamps. They wanted to take away food disproportionately from hungry kids. How can you think you're on the side of good? How do you call yourself a patriot and yet want to take away health care from millions of people? And if your immediate reaction is to go, oh yeah, well the Democrats bad, that's you being defensive because you know deep down what I'm saying is right.
Thousands of families here in Florida's 21st District rely on the Affordable Care Act subsidies to afford health insurance. But these subsidies are set to expire at the end of the year, and it's going to hit working families extremely hard. With subsidies gone, premiums can jump anywhere from $800 to $1,200 per person per year, leaving families forced to choose between groceries, rent, or their health care. Seniors and small business owners will feel the pinch first.
And here's the other thing, you guys. The job market, the economy, since Donald Trump has taken office, it is the worst economy since peak COVID time. The worst economy. The job market, non-existent. Every single month when they end up releasing the jobs report, guess what? They're not adding new jobs. They're taking away jobs here in America. That is what they are doing. And for those that aren't from America, you guys have to understand this also. A simple hospital visit for someone, if they don't have health insurance, let's say they go to the hospital, they have to go to the emergency room and they're sick and they need urgent care right then and there. A simple visit can literally cost the American person thousands, if not tens of thousands, just going to the hospital. And
Hi guys, welcome back to the channel, Rose React. Thank you so much for your support and thank you so much for clicking on this video. The US government shutdown has barely hit its second week and already millions of Americans are feeling the impact, especially the same group that once cheered for the politicians who caused it. Across social media, Trump supporters are expressing shock and anger as their healthcare costs skyrocket, their insurance plans get denied, and their benefits are suddenly on hold. The irony couldn't be clearer. Many of the same people who supported the shutdown as a quote-unquote fight against big government are now realizing that government is what kept their healthcare stable and affordable. Let's get to the video, but before, let me play a few clips on the same and I'll be back with my own commentary. All credit goes to the original creators of each and every video you see here.
In the top 5 states, according to a new analysis done, the average cost paid is $2,750 a year with subsidies. Without the subsidies, that average cost is expected to rise to $30,000 for the average family. So you're going to go from just under $216-ish a month to almost or right at $2,500 a month. Who among us can afford that kind of change just to make certain that we and our families are healthy? Because that's what Democrats are fighting for, is to keep money in American citizens' pockets and out of the pockets of billionaire corporations and CEOs. They want to make certain that the middle class and low income are protected, while Republicans want to put more money in billionaires' pockets.
I know you're thinking, well, just don't pay the bill. Well, here in America, guess what? If you have a job, they will garnish your wages. So now you're making even less money on your paycheck because you ended up having an emergency visit to the hospital. Also, here in America, if you don't have health insurance, and let's say you get taken by an ambulance and everything, let's say you need an ambulance and you call, you're like, yo, I need someone, that right there could be tens of thousands of dollars as well.
My friend who's retired, I believe she's 67 now, just got her Medicare Advantage premium details for next year. And her out-of-pocket maximum expense went from $4,200 a year to over $10,000. So if she has some kind of emergency where she requires hospitalization or emergency room care on a retiree's income, she gets to pay up to $10,200. This is Republican policy. She lives in the state of Indiana. And this is what all the cuts to everything are doing, all the budget cuts to every state. And these are the decisions each state is making individually on what's going to be cut, who's going to have to pay more. And people think that there's going to be an end to this shutdown. You've got Caroline Leavitt lying, Donald Trump lying about all these people not getting paid, all of these layoffs. They don't give a rat's ass about layoffs. If they did, they would have cared about the 280,000 federal workers who lost their job because the guy who runs X and his little 19-year-olds wanted to give so much more money to the billionaire class in tax cuts that they just stuck it to all of us. They didn't care about those 280,000 employees, former employees. And now we're coming up to nearly 1 million Americans laid off because of the tariffs, because of all the funding cuts, because of all the deportations. Almost 1 million employees. They don't care about them. They don't care about them. And to think that Republicans actually believe this administration cares about the government workers being furloughed right now over this shutdown thing. Macro view. Project 2025 wants the Affordable Care Act completely dismantled. They're gutting it. This is on their way to doing that. Once it's gutted, there'll be no more government subsidies for any of us, meaning our tax dollars being pooled collectively and then dispersed to bring down our healthcare costs. No, instead, they're going to privatize everything. So their cronies are going to make a shit ton of money, starting companies that can fill the need or just giving contracts to the companies that already exist, all those MAGA donors.
For many Americans, especially those in rural and conservative states, federal programs like Medicaid and marketplace subsidies were lifelines. But when the government shuts down, so do parts of those programs. Claims get delayed, customer service centers close, and state offices struggle without federal funding. Some hospitals are now reporting they can't process reimbursement payments, meaning people are either paying out of their pockets or skipping care altogether. In states like West Virginia, Kentucky, and Alabama, the frustration is boiling over. Residents are taking to Facebook and local news outlets complaining about losing access to medications or being unable to book appointments. Yet, these are the same areas where support for Trump remains the strongest, and where the quote-unquote small government message hit hardest. Now, reality has set in. Smaller government also means fewer safety nets. The healthcare hit is especially bad because the shutdown came right before open enrollment season. The federal website where millions sign up for Affordable Care Act coverage is running on limited staff. That means technical issues, long waits, and delayed confirmations for people renewing their coverage. And the result, higher premiums, missed deadlines, and for some, total loss of insurance. Economists are warning that if the shutdown continues, healthcare inflation could worsen. Hospitals and clinics rely on steady federal reimbursement, and when that chain breaks, the cost gets passed down to the consumers. The irony is painful. The same people chanting for quote-unquote less government spending are now seeing what happens when the government spending stops. Their bills go up. Meanwhile, Trump allies in Congress are defending the shutdown as a quote-unquote necessary stand against wasteful spending. They insist it's temporary and that Americans should hold on the line. But that message is not landing well among their base anymore. People are tired, sick, and broke. They didn't expect that standing with Trump's shutdown would mean losing their access to doctors' prescription and emergency care. Some conservative commentators are trying to spin the situation, blaming the Biden administration for not prioritizing healthcare funding. But the truth is simple. The government can't fund anything when it's shut down. And shutdown itself is a result of the political standoff driven by Trump's allies demanding massive cuts, including healthcare, Medicaid, and public programs that millions depend on. The political fallout could be huge. Voters once shouted, quote-unquote, drain the swamp, are now discovering that draining it is also draining their benefits. The same movement that promised to protect hardworking Americans has left many of them stranded with medical debts and unpaid hospital bills. Some Trump supporters online are already saying that they will never vote again after losing coverage for themselves or their children. And still, others remain loyal, convinced it's all part of some long-term plan to rebuild the system. But while they wait for that promise to materialize, their healthcare bills keep coming and the cost of their loyalty is getting higher by the day. At the heart of this crisis lies a harsh lesson. Government is not just about politics, it's about services people depend on every single day. Whether it's affordable medicine, hospital access, or disability payments, the system lands on taxpayer money and government management. When one side shuts down to make a political point, ordinary Americans, including their own supporters, are the ones who suffer first. So as the government shutdown stretches, and as more Trump voters post about their exploding healthcare costs, the reality is setting in. This is not just politics anymore. It's personal. Let me know your thoughts in the comment section below. Thanks for watching. I'll see you in the next video.